All right, let's dive into a really fascinating medication today. We're talking about something that acts like a powerful reinforcement for the body's own defenses. It's a drug that really stands on the front lines, helping patients get through some of the toughest treatments that modern medicine has.
It's a weird thought, right? A total paradox. The very treatments that are designed to save your life, like chemotherapy, can also leave you incredibly vulnerable, basically defenseless. And that central problem is exactly what we're going to unpack today, because it sets the stage for why a drug like filgrastim is just so critical.
So the problem really lies in what chemotherapy is. Most of these drugs are cytotoxic, which is just a fancy way of saying they're designed to kill cells that divide really, really fast. Now, that's great for targeting aggressive cancer cells. But here's the catch. Our bone marrow is also packed with healthy, rapidly dividing cells, and the chemo hits them too. This collateral damage is exactly what makes the treatment such a double-edged sword.
And that brings us to this specific hidden danger: neutropenia. Think of neutrophils as the foot soldiers of your immune system. They're your first responders against bacteria and fungi. When their numbers just plummet, suddenly something as simple as a common cold can become a huge threat. A fever isn't just a fever anymore. It can signal a medical emergency called febrile neutropenia, which often means a trip to the hospital. So what do? How do you fight back against this weakness that the treatment itself creates? Well, you call in reinforcements. And in this case, that reinforcement is filgrastim. It's an incredibly targeted solution, a man-made boost designed to rebuild the body's army of defenders right when they're needed the most. Now, what's so brilliant about filgrastim is that it works with your body, not against it. See, your body already makes a protein called G-CSF, which is basically the signal that tells your bone marrow, hey, make more neutrophils. Filgrastim is just a bioengineered version of that exact same signal. They literally grow it in these little E. coli factories. So it's not some foreign chemical. It's your body's own command, just delivered at a much more powerful therapeutic dose. Okay, so we know what it is, but how does it actually give the body's internal army that wake-up call? How does it get production into high gear? The strategy is actually remarkably precise. You can think of filgrastim as a drill sergeant for your bone marrow. First, it binds to the young cells, that's it shouting the orders. Second, it stimulates them to multiply like crazy, specifically telling them to become neutrophils. Third, it speeds up their training, their maturation, and shoves them out of the barracks and into the bloodstream. And finally, get this, it even enhances their function, basically priming these new soldiers to be even better at fighting infections once they're out there. And that's why this quote just hits the nail on the head. Filgrastim isn't just making more cells, it's a powerful accelerator and immobilizer. It gets more troops to the front line, faster and better prepared. It really highlights just how fast and effective this stuff is. Okay, so we know how it works. Let's look at the actual clinical missions where this tool gets deployed. Its uses are very, very specific. The most common use, by a long shot, is to prevent that dangerous neutropenia we talked about from chemotherapy. And you have to understand, this is a total game changer. Without drugs like filgrastim, a lot of the most effective high-dose chemo regimens we have today would just be too dangerous to even consider. It's also absolutely vital for stem cell transplants and for people with rare chronic neutropenia disorders. And in the world of transplants, its versatility is on full display. It's incredible. For the donor, it coaxes those precious stem cells to leave the bone marrow and enter the bloodstream, where they can be collected easily. Then, for the person receiving the transplant, it helps that new bone marrow get up and running, speeding up recovery and protecting them from infection. Two totally different but crucial jobs, all from one amazing drug. Now, of course, any medication this powerful is going to have potential side effects. But I want you to think about this not as something to be afraid of, but as empowerment. It's about knowing what to expect and what to watch out for. The most common side effect by far is bone pain, usually in the pelvis or the big bones in your legs. But what's so fascinating is that this pain is actually a sign that the medicine is working. It's caused by the bone marrow literally expanding as it works overtime to turn out billions of new neutrophils. It's the feeling of your body's internal factories going into overdrive. So it's really important to separate the common, totally manageable side effects from the serious, but really rare ones. Things like a reaction at the injection site or feeling tired, that's kind of expected. But symptoms like a sudden, sharp pain in your abdomen could signal a problem with the spleen, and that requires immediate medical attention. Knowing the difference is everything. There's also a complex point we need to touch on. When filgrastim is used with certain chemo and radiation treatments, especially for blood cancers, there's a known risk of developing other conditions down the line. Now, the current thinking is that filgrastim doesn't cause cancer itself, but it might promote the growth of abnormal cells that were already there. It's a risk that doctors have to weigh very carefully against the massive life-saving benefits. So, given its power and those potential side effects, using filgrastim safely is all about sticking to a strict protocol. Let's run through the practical need-to-know details.
It's usually a simple injection right under the skin, kind of like an insulin shot. The timing is absolutely critical. It's given a day or two after chemo, never before. The dose is completely customized for each patient, and you have to store it right. It's a protein, so if you freeze it or shake it, you can basically destroy it. And this part is non-negotiable. For safety, patients on filgrastim need frequent blood tests, specifically a CBC or complete blood count. This lets the medical team see exactly how the bone marrow is responding. They need to make sure the neutrophil count comes up to a safe level, but not too high, because that could cause its own set of problems. It's all about a carefully managed response. When you put it all together, you realize filgrastim isn't just another drug on the shelf. It is a fundamental pillar of what we call supportive care. It lets doctors use more effective doses of chemotherapy and makes things like stem cell transplants way safer. It has totally changed the game for thousands and thousands of patients. And that leaves us with one final thought. Filgrastim is the perfect example of supportive care, medicine that doesn't just attack the disease, but actually strengthens the patient. So the big question for the future is, as our main treatments get even more powerful, how do we keep innovating to find new and better ways to support the body through that fight? Thanks for joining me.